that cleaner in. There has been no change, so we continue to offer the 5% wash. Amongst and the glycolic acid cleanser that we offer, which is a 10%, also stays the same, and that is the Glycolics Gentle Facial Cleanser. And when we use that mostly for oilier skin, so our acne patients who have really oily skin will benefit most from that. There are rare other patients who have maybe lots of sebaceous gland hyperplasias, have rosacea of the oily type. They will also benefit from this particular cleanser. And we also have a lotion that we use as to help substances penetrate, and that is safe for all types of skin, for dry skin, including atopic dermatitis. If you need to hydrate the skin alongside with acne treatment, which can be drying, and we use a lotion that we call glycolic body lotion. It is not for body only, and it is actually designated glycolic face and body lotion. So on the actual description of the product that we have in each office, you'll see it can be used for both. It has a nice ability to reduce keratosis pilaris on the body as well. It is used oftentimes to treat patients who have recurrent folliculitis if we simply need to help the skin open up just a little bit and be a little bit less clogged so that folliculitis does not occur. There is a slightly stronger version of glycolic acid that we use for the face in those who really need extra permeation of, let's say, a retinoid. So in other words, if we use a glycolic acid just before a retinoid or in synergy with a retinoid, we can actually make the retinoid more powerful. And I'm going to direct you towards the very bottom where we're talking about acne again. And you see glycential silk here, which is more powerful than the glycolic body lotion. So the glycolic body lotion has an advantage. It's relatively inexpensive for the amount that you're going to get. It's a very large bottle, whereas the glycential silk is a small amount, but it's much more powerful than the glycolic lotion. I'm going to go back to the acne products. Any questions about acne products at this moment? Okay, so moving into the next one that we call daily maintenance, there is again a glycolic acid moisturizer. Makes a lot of sense to use glycolic acid for cleansing because it helps chemically exfoliate skin. So in other words, if you really want to get the substances that you want to use afterwards to reach your skin, then using glycolic acid will very, very gently remove dead skin cells without having to scrub, without having to irritate the skin. And this one is the moisturizing cleanser. So that is good for dry skin, for normal skin. It's pretty much for everybody who would like to use glycolic acid and who feels they might benefit from it. Because it removes dead skin cells, it's a nice glow and smooth feel on the skin. We have our glycel pads. They are oftentimes also used in acne, but can be used on oilier skin of any, at any point of time in our lives. You don't have to be teenage or younger years in order to benefit from them. And as the glycel pads say, it is glycolic acid combined with salicylic acid. So for example, in pregnancy, we don't like to use salicylic acid because officially the salicylic acid labeling is category D, and that is due to its oral form. So if you were to take salicylic acid in form of aspirin, that would be category D. But the topical formulations don't have a different pregnancy category than any oral medications, and hence it is a very slippery slope when we're dealing with pregnancy, and the expectation that a small molecule could enter the skin and maybe there was going to be some harm. So we usually stay away from them, but everybody who's not pregnant will nicely benefit, and they usually just are applied once daily. The The next on the list in the daily maintenance are our sunscreens, and we have a mineral sheer mineral sunscreen, and we have a tinted. And these are really the only two sunscreens that we're currently offering anymore. The mineral sunscreen, interestingly, looks much better on the darker the skin is. So we tested, you know, different types of ethnicities, different types of complexion, and we noticed that the tinted screen works really well on the fair skin, and the sheer mineral works best on the darker skinned individual. So, and maybe the cutoff is between a skin type kind of 4, meaning the Mediterranean, light Asian kind of complexion. And so maybe the person might need to try the tester in order to see what looks best on, you know, their hands. But again, if you're kind of towards more the darker complexion, like Indian, or, you know, the really sort of skin types 5, and definitely skin type 6, you want to recommend the mineral sunscreen, whereas the tinted sunscreens work well for the very fair skinned, or not so very, but, you know, the fairer skinned individuals. We also have the next product listed here, is the Rad Essential Cleanser. We wanted to bring this in, but this is not available at this very moment, and there's still some debate as to whether we're bringing just a cleanser that doesn't have any extra ingredients. All right, moving forward, next one down is Radiance in a Bottle. Maybe I'm gonna ask, are there any questions so far? All right, so now we're going to go into kind of an anti-aging approach. And there are a number of different things that we're considering for anti-aging. And all of you have heard me speak a little bit about how we view the anti-aging pyramid. At the base of it is sunscreens. The next layer over is using a tretinoin or retinoid. Adapalene is also a retinoid, is not as powerful in anti-aging properties, but very rarely, if a retinoid cannot be tolerated, might even be considered. Tazarotene or Tazorac is another one of those. It's a different type of retinoid, much, much stronger. Next one over on the list is typically peptide technology. Peptide technology may be combined with growth factors. And what is finishing off the pyramid is something that just restores glow on the skin. And amongst those products, Radiance in a Bottle is one of those that just finish off the pyramid. So while it really is a fraction of the anti-aging overall effort, it contains a number of antioxidants, vitamin C, E, and folic acid, and they all help to brighten the skin, reduce fine lines, and that's because they are scavengers for free radicals. And free radicals occur when environmental factors and rays that are around us are attacking the skin. And so they are really dealing with them. Melanage Advanced Brightening Cream is in this list here only because it usually is compounded with a retinoid. It helps the overall kind of restoration of a glow, is applied over the entire face, not just to areas of brown, where we compound arbutase in order to resolve the brown, but because arbutase penetrates deeply into the skin, it actually restores pigment uniformly rather than in a spot form. So in other words, if you were to compare Melanage Advanced Brightening Cream that has arbutase or arbutin, which is some sort of a precursor to hydroquinone, and you compare to hydroquinone, the hydroquinone is applied on the outside just to spots, just to areas of hyperpigmentation, because it has a direct whitening effect. It is directly inhibiting melanocytes also at the very surface, whereas the arbutase in Melanage Advanced Brightening Cream first penetrates underneath and knocks out the enzyme that's responsible for this storing of a lot of pigment deeper down, knocks out that enzyme, and that is how it allows very, very broadly to make the skin, make hyperpigmented skin, including melasma skin, look a lot better without having to focus this cream only on the melasma area. Glycential cream is a glycolic cream. It is great for people with drier skin, people who really want to push moisture into their skin. So glycolic acid as a molecule is a very powerful humectant. Humectant is a molecule that allows water to be transported in. And the way that glycolic acid works, it swells the skin cells. And so they are closer to each other and it removes dead skin cells. You've just heard that before when we spoke a little bit about the lotion and the cleansers. And so it really helps to push a lot of water into the skin. It makes the skin super smooth, super nice in texture. And we have a version that is called glycential cream, which is kind of tolerated by everybody. And somebody who's been on glycential cream and looks for just a little bit more usually goes to the next step over, which is called boosted glycential cream. And that is equivalent to what we used to have in the past, which was glycolic acid high potency cream, and it used to contain 20% glycolic acid. This one here is in an unbuffered version and will be having the same power. Is it the same as a 20% glycolic acid peel? Almost. And so it's really only for those who've been exposed to glycolic acid products for a little while, they will be able to tolerate this just nicely. What happens if you were to put a higher percentage glycolic acid on somebody who normally is not exposed to it? They just feel a lot of stinging on the skin for, definitely several minutes a day. It's a little bit of a process, so it's easier to go through and titrating up rather than overloading the skin at once. Next one over is Brilliance in a pad and Brilliance in a bottle. I'm going to try to explain them a little bit together because they share some ingredients, which is TCA or trichloroacetic acid, in a low concentration. And so they are also giving very, very nice and smooth skin. So Brilliance in a pad is designed as an anti-aging kind of, maybe it's a mini peel, mini prep. It's not a peel, no skin will peel afterwards. We use it usually once a week. In some of our patients, we recommend twice a week. Some of our patients use it every other day. I think that's a little bit too much. And the pad contains also some salicylic acid for the exfoliation, but the TCA is what's making the skin really nice and smooth. The Brilliance in a bottle is a lotion that some people who are absolutely not tolerating tretinoin will be able to use because it contains retinol. And you guys know that I'm not a huge fan of retinol because it's not really very predictable how much of retinol will transfer into retinoid. But it's a good compromise for those who truly have difficulties with the retinoid. And so they use it at nighttime. It's a great kind of turnover product, anti-aging product. All right, we spoke already about the glycential silk. I'm not sure why the Perfecting Eye Balm and the Peptide Bliss are on the side of acne, so I'm going to ask you to ignore that. So we have a number of different eye creams. I'm going to bring the screen up a little bit. So there's the Perfecting Eye Balm and there's the Illuminating Eye Balm. So the Perfecting Eye Balm is just basically, a great combination of peptides, antioxidants. There's some growth factors inside. So it is replacing the Elastin eye cream. And it's kind of a mixture between the Lumiere Riche and the regular Lumiere, but it's really a perfect eye cream. We have gotten raving reviews by our patients since we've introduced this one. And the Illuminating Eye Balm is one that we would use in order to counteract dark circles. And so it has this kind of brightening product inside that helps the skin. Also, so far, that has really found great reviews with our patients. There is something here that's called Perfecting Neck Balm. You see that it has instead, so the Perfecting Eye Balm, Perfecting Neck Balm, they have products inside those growth factors, antioxidants inside, and that's why we gave them all the same name. So this one replaces Nectapharm, and unlike on the face, on the neck, we can actually tighten skin quite a little bit. Those fine horizontal lines usually reduce very, very significantly or go away with these neck creams. And although it works on the neck to tighten skin, the same does not simply help on the face. So it's not like you can just, recommend using a neck to tighten also on the face and hope for the same. That's not going to be helpful there. And we believe the answer is in the number of oil glands that is much, much higher on the face than on the neck. I'm going to move upward again. There's Hyla cream here. Hyla Sensual Cream is a product that we brought in because many of our patients, oftentimes who are a little bit older or have super dry skin, they don't feel that a glycolic acid cream is giving them enough. So this particular product is much more powerful than simply using glycolic acid. So here we're dealing with another acid. It's hyaluronic acid. And you know that hyaluronic acid is also one of those humectants. And is oftentimes, recommended, particularly when we recommend like the Neutrogena Hydro Boost products. And we do not have as much hyaluronic acid in Hydro Boost as is in this Hyla Sensual. And some patients have difficulties with the Hydro Boost products. About 5% of them create a perioral dermatitis-like rash because there's a product in the gel cream, in the Neutrogena Hydro Boost gel cream that does not that seems to be, irritating to skin. So the Hyla Sensual doesn't contain any upsetting preservative or anything that might be causing an irritation. In addition, it contains ceramides, and ceramides are lipids that we are able to apply to skin, and they, to a certain degree, actually get absorbed and replace the loss of lipids that we sometimes experience. I'm going to move one up to Peptide Bliss. There's a misspelling here. It's supposed to be peptide, not peptides. And that is a product where we have tons of peptides inside, very, very similar to, let's say, elastin products. It's much less expensive than elastin because it's missing this particular structure that allows splicing out of old collagen. But so this one really just delivers peptides, and peptides have been abused by the cosmetic industry. They've originally been introduced to treat burned skin and have been able to do much better than simple coatings of burn wounds. And so they've been able to restore skin. And this is how they moved into the cosmetic market. We oftentimes use Peptide Bliss now for before and after procedure in order to have the best possible, the fastest possible healing available. I'm going to go up again one more time. So up here in the very, very top, you see we still have elastin skin nectar in our portfolio. We will still have for a little while. We are working with our chemists to see if they can find something that's even better than elastin skin nectar. We're currently testing a version that was already provided to us a few weeks ago. So that should be hopefully good to go sometime soon. And there's Leticia, everybody's familiar. It's causing the elongation of lashes and also creates slightly thicker lashes, can be used on the brows, can be used to induce hair growth anywhere on the body. It's a prescription product and it's pregnancy category C. So everybody who receives it must absolutely be asked if they're pregnant or nursing a baby and will not be handed out if that is the case. We are keeping also the Derma nail conditioner. So in people who are really overusing their hands, very frequent hand washing, doing their dishes in water and get these splits and have nails that just don't want to grow and break, they can use Derma nail conditioner. This is a daily product that you apply, not on top of the nail, but around the nail fold. So nobody needs to take off their nail polish. And it does take up to 6 months to notice that the nails become thicker. Obviously, if you don't use it anymore and you go back to your old habits of having tons of water exposure, it can happen again. For some people in whom aging is the main driver of why their nail is brittle, it will also help. It actually contains some hydroxy acid, which is the heading category of glycolic acid, lactic acid, and so on and so forth. But this hydroxy acid will help stabilize the nail. Any questions so far?
Is the Peptide Bliss one better than the elastin peptide?
Megan, I need to make you a little bit louder. You're too quiet on my screen.
Oh, Is the the peptide bliss better at delivering peptides than the elastin product that we have, or is the elastin one a bit stronger?
So the elastin has a peptide sequence that allows the splicing of denatured collagen. So some denatures collagen over time, and it kind of clumps up underneath the skin, and that's when that looks puckered in sun damaged skin. And the elastin has a peptide sequence that allows the splicing of that denatured collagen, and it basically moves it away from here. And this is unique to the elastin product and is not found in any of the other peptide products. So is it stronger? Well, if you are looking at before and after procedure care, the peptide bliss and the elastin skin nectar are going to be the same. But if you're looking to use a product just by itself, never do a procedure, and you have sun damaged skin, then the elastin skin nectar would be the more powerful product. It's not going to deliver as much as a procedure, right? But it really is a nice feature to be able to remove this denatured collagen. No questions for anybody?
I have one little question. Patients
Yes.
always ask me what the real difference is between the glycolic moisturizing cleanser and the gentle cleanser. I usually just tell them it's the skin type, but I mean, is it just the base that the glycolic acid is in, or is there actually something else in it?
No, actually it's just the base. And so there's not a different product that makes it more unique to oily skin versus dry skin. So really the base is different. And so those people who have oilier skin, they like this kind of, you know, they feel that with this, with the gentle cleanser, which is the one for oily skin, they remove, you know, they remove the oil more efficiently. Whereas in a gentle cleanser, you have, well, I mean, there are some obviously differences in the base ingredients, right? In a moisturizing cleanser, you have substances that actually smooth the skin over during the cleansing process. You know, like how about 15 years ago, new kind of cleansers came to the market that cleansed and moisturized in the shower at the same time. And I don't know who it was. Olay had this product that was called Ribbons or something like that. Maybe that wasn't the name, but that's how they advertised it. And so in moisturizing cleansers, you have certain components that are working less like a soap than the traditional other cleansers. Does that make sense?
Yeah.
I have a question. The vitamin C is not pregnancy safe, correct?
So yeah, you bring a good issue up, Blake. So there has been this original labeling that John put on the bottles when we first got the batch, when we ordered it, did include that it's not pregnancy safe, but it's a misstatement and we're going to rectify it. And I had sent an email in eClinical Works a few months back when I had spoken to him. And so the way that John, our chemist, views vitamin C is we don't know if any amount of vitamin C can ever enter the body and whether or not that can cause issues with pregnancy. So you need to know that vitamin C is very popular on the black market for abortions. Well, is it very successful at that? Probably not. But if you take extremely high amounts of vitamin C in early stages of pregnancy, you might be able to abort the pregnancy. And this is the reason that he originally came with this statement. So I was able to rectify what appeared to be, I mean, again, it's not that it's unsafe in pregnancy. And those, you know, few molecules that are in a topical have not ever been associated with the ability to have a, let's say, miscarriage or to induce an abortion. And so he actually reformulated the writing to say, speak to your physician before using a product when you're nursing or pregnant. So it's not unsafe, and we continue to use it. And he had put the same on any glycolic acid product, and we were able to to rephrase that. So all of the newer ones, all of the newer batches don't have that sentence anymore, which is an incorrect representation of how science actually feels about that, knows about that. So. No questions? Stacy, can you put yourself back on and just confirm that we're ending the meeting?
Yeah, I'm here. I can't think of anything else unless there's something somebody else has that wasn't brought up at the last meeting while we're all here. So if you have anything else, anyone?
If nobody has anything else, we're going to conclude the meeting. And if you guys had any particular questions, you just wanted to email me, email through ECW and let me know if you need any clarification on anything else. Okay?
And we're going to be recording this so that if people miss for whatever reason, they'll be able to watch it too, right?
I don't know if where he is in the game. I see him on the screen, but I mean, like I see his picture on the screen, but I'm not really sure if he's listening in. I think the session was recorded.
Okay, I'll touch base with him.
Okay, great. Thanks so much. Bye-bye.
Bye.
Bye, guys.
Bye.